Hello, I'm Dr. Ruth Roberts, your pet's ally, and I hope folks can filter in and join us for this discussion about vaccines and preventive care. So as they come in, you may hear some beeps, things of that nature, but we'll just roll through it. Hopefully folks can join. At any rate, what I wanted to talk to you about today are things that are considered to be preventive care by most of my colleagues. And what I'll do is create a PDF and upload it with the recorded video so you can download it and use it at will. And what I'd like to do is cover some basic concepts on what is preventive care, what are vaccines supposed to do, what is all this stuff that they tell us to do every year, and why do we need to do it. So firstly, preventive care is supposed to be about preventing disease, right? But the chief things that are focused on in conventional veterinary medicine are the diseases against which we can vaccinate. So rabies for both dogs and cats, distemper and parvo for dogs, kennel cough, hepatitis, and parainfluenza. And then there's all these other vaccines, Lyme disease, leptospirosis, all this stuff. And what's necessary? There are folks that say, oh, if you feed your pet correctly, if you feed it raw and you make it a really vital pet, then it'll never get these diseases. And sometimes that works out and sometimes it doesn't. I've had a number of clients in practice that were using heartworm nosodes, which is a homeopathic way to prevent disease, actually see their pets develop heartworms. The idea of exposing your dog to a small amount of parvovirus every week does seem to help and keep them protected. And so there's some validity to everything and some not so valid points to other ones. So let's start with vaccines. The basic underlying concept of vaccination is the herd health concept. And what that means is that if 10% of the population is vaccinated against a particular disease, then the entire population will be prevented from being annihilated or wiped out if that disease becomes endemic. For instance, in the American West, hydrophobia, if y'all have ever watched the movie Old Yeller, was a huge problem because there were lots of wild animals running around. Dogs and cats would be infected. Many people died from rabies. And so this is something that in the current anti-vaxxer movement or what have you, there's not a lot of reality here. And we haven't had a disease that has killed that many people and animals. Ebola vaccine has finally been developed and released. And what they found in the last trial with, howdy, hey Bettina, how are you? Is that this vaccine worked so well that it completely eliminated the disease in people and prevented the outbreak from happening. So a lot of folks will say, oh, you shouldn't vaccinate your animals. It's just not necessary. But what I can tell you is that I saw dogs with parvo and I saw dogs with distemper in the year I retired in 2016. And there was a woman in South Carolina that died from rabies because she had been exposed, oddly, to a bat. There was a woman that died of rabies recently. She went to India and she got bitten by a dog and, oddly, didn't tell anybody about it and died from rabies. So really weird stuff going on. And so these diseases are still a big problem. So as far as what's really necessary, we've had more of a rational conversation about that in veterinary medicine than we have had in human medicine. And I think that's a lot of what the problem is on the human side, is that there's so much controversy out there and not a lot of science. That's the other thing that's a bit frustrating. I've had doctors tell me, MDs tell me, that I have no business talking about vaccines on the human side. And what this doctor was telling me is that she's seen children die of the flu because they were unvaccinated. And the flu vaccine has a whole nother bag of wax around it. I think this year it's down to something like a 38% efficacy. So at any rate, with all of this stuff, so what do dogs and cats really need? The things that they really need have actually been laid out pretty well. And what I'm going to do is share my screen and show you a few sites here. So first of all, I think that most people can agree that rabies vaccine is something that is needed. And is it needed as often as it is given? That is currently up for debate. So the compendium put out by the National Association of State Public Health Veterinarians in 2016 introduced the idea that maybe a titer really is protective, shows evidence of protection. And interestingly, in this document, they said that if an animal bites a person, and this is where we tend to get into trouble with unvaccinated animals, if an animal bites a person, if they go in a 10-day quarantine, then if they have ever had a rabies vaccine, they are considered up to date, even if that vaccine was 10 years ago. And then at the end of that 10-day quarantine, they will ask the owner of the pet to revaccinate at that point. So I found that very curious. So I think what they're finding is that, yeah, the duration of immunity truly is a lot longer than 3 years. And helping along with that was the rabies challenge study, which I think has ended. So they've got this position statement about what they've been able to do, and they have done quite a bit. They've been able to help several states have the ammunition to change their ordinances and change from annual and biennial booster mandates to the 3-year vaccines, which is okay. The thing that's interesting about this is that at 5 years, what they found was that the titers, which is what the goal of this whole thing was, to say, okay, we vaccinated these animals 7 years ago, and now the titers show that they are still protected against rabies. And the titer has to be 1 to 5, meaning 1 part blood to 5 parts diluent, and there's still enough antibody in there to neutralize an active virus. So that didn't happen, unfortunately. At year 4 and at year 5, the titers started dropping below protective numbers. And Dr. Schultz and Dr. Dodds were behind getting this challenge going. And a couple of interesting things happened. So they still challenged these animals that had been vaccinated but didn't have sufficient antibodies to prove that they were protected to virulent rabies. And they were all protected. The problem is that the control animals, only 79% of them developed rabies. And for a study to be valid in the FDA's eyes, 80% of the animals have to develop the virus itself, develop fulminant rabies. So they never were able to get this completed. The theory is that the immune system, the general bank of information in there, was sufficient to provide protection against the rabies virus, even though the titer values were dropping. So that was confusing, and it confuses most veterinarians. So God help us trying to get this across. But long story short, the duration of immunity is longer than 3 years, but you can't know how long for a specific animal until you've actually done a titer. And that goes back to that herd health idea, that if only 10% of the total population is protected by a vaccine, then the entire population is not going to suffer an annihilating event. So for instance, I think it was 1911, the Spanish flu ran through the world and killed 30% of humans on the planet. That's astonishing. So the same idea, that was horrible. And this is why a flu vaccine is the holy grail, because of the concern of another pandemic coming back. Okay, percent of the population vaccinated against rabies, but what if my dog gets it? And that's the problem. And the current measles epidemic, that happened last year and will probably happen again this year. That was a big issue. Their numbers were not enormous, and generally measles is not life-threatening, but it does kill some people, and it's going to put you on your butt in the bed for 2 weeks. If you had the opportunity to have a vaccine to prevent that experience, plus all of the other potential side effects down the road from that really intense inflammation, then wouldn't you want that? And this is the concept behind most veterinarians' vaccine schedules, is that you just don't want your pet to get sick. Why put your pet through parvovirus, even though the survival rate is quite high, when it's not necessary? So to that end, what else is truly necessary? There's two groups that have developed vaccine guidelines. And the first one is the American Animal Hospital Association Canine Vaccine Guidelines. And the reason it's just canine is because the American Feline Practitioners Association developed the guidelines for cats. And in these guidelines, they will give you what's core, what's non-core, and then their recommendations for how to give vaccines. So I want you to look at this, realizing that there are many industry people in here that help set up these guidelines. So what they couldn't say is only do this and that, because there is so much individual variation between veterinarians. So it says beginning as early as 6 weeks of age, administer doses every 2 to 4 weeks until they're at least 16 weeks of age. Now, what Dr. Schultz says is that if you vaccinate at 14 weeks, anywhere between 12 and 14 weeks, and then 4 weeks later at 16 to 18 weeks, you're good to go. And in fact, he says any vaccine given after 14 weeks of age will confer immunity, and there's no need to have additional boosters. So that's not in here because they couldn't get anybody to agree on making really one consistent set of recommendations. Because unfortunately industry is dictating, and individual veterinarians are dictating what they are willing to do or not do. And then again, for a dog over 16 weeks of age, if you're not sure of their vaccine history, administer 1 or 2 doses of a combination vaccine below. It is so variable. And again, they go on to talk about, okay, what's core? So modified live distemper parvovirus, rabies is core, meaning it's necessary. And then here's non-core. So there's a lot down here in the non-core portion. And there's a lot of stuff that is not even non-core. And I think they took out the not recommended ones. So for instance, the rattlesnake vaccine used to be not recommended. And then the other ones, coronavirus, I think you'll see has disappeared from here as well. I'll have links to all of these things for you all in handouts so that you'll be able to go back and look at them at your leisure. So again, core is distemper parvo and rabies. And if you look at these fractions that they mention are in the vaccine, parvovirus, adenovirus 2, which is referred to as herpes virus as well, and parainfluenza virus and distemper virus. These are considered core, and then it's plus or minus on the parainfluenza virus. Parainfluenza can help with preventing respiratory disease like Bordetella vaccine. Again, down to non-core, and I don't think they mentioned the titers in here at all yet. Under non-core, Bordetella bronchoseptica, so kennel cough, and canine parainfluenza. So this a single intranasal dose for puppies between 8 and 16 weeks of age. And when I was in practice, I used to vaccinate for this the first time I saw the puppy with the intranasal vaccine. A lot of kennels require you to do it every 6 months. And there's absolutely no rationale behind that whatsoever. That's a frustrating one. The parenteral and intranasal ones, so the parenteral is injection under the skin, and the other one's leptospirosis. They say over here in the notes, because there's limited cross protection between the serovars, doing the administration of the 4-valency vaccine is recommended over a 2 serovar vaccine. and they don't recommend adding in a combined product. It's just leptospirosis, I think, has been really well marketed, but really not needed for so many pets. And then the other big one is the flu vaccine. So again, you have to really decide what is your pet going to be exposed to. And there's 2 flu vaccines now. And my understanding is that neither one of them works particularly fantastically well. If you're training dogs or if you're on a agility or showing dogs, then that's something to consider, because it is something that's out there, especially I think in the Atlanta, Chicago, and down in Florida around the racetracks, although that's starting to go away. So that's the dog vaccines. And then the cat vaccines. Again, the American Association of Feline Practitioners has some downloads available for vaccine guidelines. In their summary, same concepts, core and non-core. So panleukopenia and herpes virus, and then calicivirus. So this is the upper respiratory vaccine. Panleukopenia is a really dreadful disease that causes just screaming, dreadful diarrhea. And we do still see that in kittens as well. So again, when do you start that? Begin as early as 6 weeks, and then every 3 to 4 weeks until 16 weeks of age. One thing I forgot to mention when I was speaking about the dog vaccines is that maternal antibodies, what the mother has passed on to the puppy or kitten, prevent them from responding to vaccines until after they have dropped, which is generally somewhere around 12 weeks of age. So in shelter situations, they vaccinate as soon as the animal comes through the door because they have this enormous population and they have no idea about the history, if they've actually nursed from mother and received colostrum and protection or not. That's why there's the other part of the variation. But for puppies and kittens, I think waiting until 12 weeks of age for distemper parvo and the upper respiratory virus vaccine makes sense. And then boostering that last distemper parvo or upper respiratory virus vaccine at 16 weeks of age. Again, rabies vaccine is considered to be core. And then feline leukemia is considered to be non-core. The interesting thing about feline leukemia is that years ago, it was killing, 30 years ago, it was just killing cats left and center. It was horrible. What seems to have happened is it's not as big of an issue out in the wild population anymore. We do still see it. And weirdly, if your cat has gotten to the age of 2, they seem to develop their own sort of ability to protect themselves from feline leukemia without ever having had a vaccine. And so I don't know if that's exposure to other cats or what the deal is, but we used to say, okay, we need to vaccinate every kitten. It turned out that didn't really make sense. So again, you've got to consider what your cat's exposure risk is. Feline immunodeficiency vaccine, I think this is one of those that it just really has not been helpful. And in fact, for some cats, there's the thought that they have developed more severe disease with the vaccine than without it. So I think if they are vaccinated, they're going to test positive. So there's some problems with it. Feline infectious peritonitis, not recommended because it tends to make them positive for tests and not actually protect them. And then chlamydia fila is non-core. And again, it's just not really that great of a vaccine. Same thing with the kennel cough vaccine for cats and also the feline Giardia vaccine. It actually made a lot of cats sick. So I hope that is helpful. So that's vaccines. The other thing I want to mention is that if you need to vaccinate your pet, do use Thuja. And there's a topical one and an oral one. People have used the topical one orally without a problem. And the way you would use this is to give 1 drop per 10 pounds of body weight twice a day for 5 days after the vaccine. So rabies vaccine, the distemper parvo, the feline upper respiratory. So to give you some frame of reference again, the schedule that I used in practice was for puppies and kittens, distemper parvo or upper respiratory virus vaccine at 12 weeks, and then repeat again at 6 weeks, and then rabies at 18 to 20 weeks. At 1 year, I would suggest recommending revaccinating for the core vaccines, distemper parvo and upper respiratory virus vaccine, and the rabies vaccine, but separate them by 3 to 4 weeks and use thuja after each vaccine is given. Now, for dogs, the Bordetella, the upper respiratory virus for dogs, or kennel cough, I would give that at 8 weeks of age or as soon as they came into the office. So that's the deal there. And then if they have continued exposure to dog parks, boarding facilities, things of that nature, then continue to revaccinate. So after a year, after that 1 year, then now we're considering that the distemper parvo vaccine and the feline upper respiratory virus vaccine are good for at least 3 years, meaning their duration of immunity at least gets them out to 3 years. And the rabies virus vaccine license at this point is good for 3 years. So what happens in 3 years with my clients, I would recommend doing a titer, which is a blood test. And recently, I guess Dr. Rob, who's been campaigning about not over-vaccinating for pets, and God knows we need the support, has offered a program where if you get your vet to draw the blood and send it to K-State, then he'll interpret the titer for you. And that kind of makes me scratch my head a little bit, because your veterinarian has to buy into that, or else they're going to consider your pet unvaccinated. So there's a ton of science out there to show that this really is the science and the truth about it. So that's it for pups and kittens. But what do you do if your pet's had a vaccine reaction? And my first thought is don't revaccinate. So back in the day, when I was first in practice, we would give dexamethasone, which is a steroid, to prevent the vaccine reaction. But what we've done is basically suppress their immune system so they can't respond to the vaccine, period. And so that doesn't make sense. And then some veterinarians will give an antihistamine, but your pet is still going to have an immune response to that vaccine, and then potentially have other issues like autohemolytic anemia pop up, which is pretty awful. So I would talk to your veterinarian and get a titer done. And where this becomes frustrating is there are a certain number of animals, dogs and cats, that are considered to be non-responders, meaning that you could vaccinate them every month and they will never develop a titer. And so it's important to understand that concept. So you get a titer done and it's negative, and you vaccinate and you retest 3 months later and it's still negative. What does that mean? Oh, well, let's just vaccinate them again. No, they're non-responders. Stop right there, because you're not going to get a vaccine response, and there are potential side effects from repeating the vaccine so frequently. So if your veterinarian has difficulty understanding the concept of titers, please ask them to reach out to me. I'm happy to help them understand it and walk them through some of the science based on that protocol. So I think that's got vaccines pretty well covered. And the next thing I wanted to talk to you about is all of the other things that are considered to be preventive care. So the other thing your veterinarian is convinced about is that every pet needs to be spayed and neutered as soon as possible. We got to rip those gonads out. Some years ago, obviously in 2015, this gentleman from the Gerald Murphy Cancer Foundation, and also he's involved in the longevity studies in particular, did the Old Gray Muzzle Tour. And he went to the homes of the oldest Rottweilers in the country. And so these dogs are comparably aged to people that are 100. And so what did he find out that all of these dogs had in common? What he found out was that they were either never spayed or neutered, or it was after 5 years of age. And these dogs, Rottweilers living to be 12 is pretty remarkable. These guys were 14 and 15, 16. This is just beyond ancient for a Rottweiler. So many of these dogs died with cancer, but they didn't die of cancer. And that's an important distinction. So they were able to live a really high quality life and just did remarkably well. University of California in Davis did a study probably 12 years ago looking at the medical records of golden retrievers, and then a second study they released 2 years later comparing Labradors and golden retrievers. And what they found was this: male dogs that were intact, meaning they had not been neutered, there was 0 incidence of cranial cruciate rupture. The incidence of most joint disease went close to 0, or was remarkably less severe in dogs that had not been spayed or neutered. And the incidence of cancer was much, much lower in these 2 breeds that we know are predisposed to cancer if they had not been spayed or neutered, or they were spayed and neutered later in life. So what does that mean? Does that mean, your dog is just in deep trouble if it's already been spayed or neutered by the time that it gets to you? And it doesn't, but it means that you need to be cautious in the way that you feed, in the way that you approach things. So this is the American Humane Society has gotten the word out that spaying and neutering prevents pet overpopulation, and indeed it does. So in Charleston County alone, I can tell you that in 1990, 35,000 animals a year were euthanized because they were homeless. Before the local Humane Society went to being a no-kill shelter, the euthanasia rate had dropped to something like 5,000 animals a year in an area where the human population had increased tenfold. So I think that's really quite remarkable. And indeed, spaying and neutering does prevent suffering. These animals are not out running around, getting hit by cars, getting into dog fights, having litters after litters, and being sick from that. When I first was in practice, I treated uterine infections or pyometras all the time. I treated hit by cars. I treated lots of dog fight wounds because these guys were all out roaming with their gonads, telling them what to do. Once spaying and neutering happened, a couple of things happened. One is we began to accept pets as our buddies. And so they started coming inside. Again, I'm in rural South Carolina. This is when animals were at best inside of a chain link fence. At worst, they were tied out or staked out. So the level of humanity increased dramatically over that period of time as well. Spaying and neutering early, and we do see puppies and kittens come out of the Humane Society spayed and neutered as early as 8 weeks old, can have pretty significant effects. For male cats, it certainly increases their chance of developing urethral obstruction, otherwise known as "I can't pee, so please take me to the vet right now because otherwise my kidneys will fry." And the reason that happens is that they never become hormone competent. And so the urethra, which is already a tube that tapers down to a point, becomes much thinner, and it becomes easier for either crystals or mucus to plug that up. Now, in dogs and cats, what happens? And I think the studies I just told you about as far as UC Davis goes, our hormones are doing something aside from making us look like boy dogs or girl dogs and being able to reproduce. They drive the entire endocrine system, the thyroid system, the adrenal glands, the whole 9 yards. And so, there are health consequences down the road. So how can we combat that? First of all, if your pet, let me take the easy road, if your pet is not already spayed and neutered, fight like hell to not have them spayed or neutered until they are at least 5 years old or older. At that point, probably your veterinarian is going to give up trying to get you to get them spayed or neutered. And if something happens, like the male dogs develop prostatitis, so an inflammation of the prostate gland, neutering does help with that. There's a couple of other solutions. And if your female dog develops a uterine infection, and you spay and neuter, that's roughly the equivalent time in our lives when we go through menopause and andropause. If you can get all the way out to the end of your pet's life without spaying and neutering, so much better. It's well known in women now that if they used to if you have an ovarian cyst and worry about There's a concern about ovarian cancer. They used to take both ovaries. They finally realized that in doing that, they just took 4 years off of your life. So the current guideline on the human side is not to take both ovaries unless absolutely necessary until after the age of 65. And they'll probably lengthen that out. So again, if they're not already spayed and neutered, try like hell to wait until they're 5 years of age. At minimum, get them through at least 18 months of age. 2 years would be better for male dogs, and at least through 1 season, preferably 2 for female dogs. Now, what if your pet's already spayed and neutered? The thing you can do is to limit exposure to other things that are going to whack out their endocrine systems. So things like really pro-inflammatory foods, so the conventional dog foods, excess amounts of vaccinations, excess amounts of pesticides, which are hormone mimics, excess amounts of other medications. And I would tell you, many of our crock pet folks will agree that feeding crock pet diet, real whole food that helps work with the body is the way to go. And then the other thing I strongly recommend is some sort of a glandular supplement. And Standard Process for years was really the only multivitamin available for dogs and cats with glandular products. They actually are not complete multivitamins, and so that's why I developed Holistic Total Body Support. So you would have something to balance a cooked diet and make sure that all the nutrients were there, as well as provide the glandular components to support the rest of the endocrine system. So that's the best thing you can do. And one of the other things I will talk about in a minute is what do you do about heartworm prevention and flea control and all of that stuff. And the thing I would say there is look at where you are. So do you live in South Carolina? If that's the case, then that's when you want to use heartworm prevention on a regular basis. And the regular basis is probably back to every 8 weeks at this point. If you live in the middle of Montana, do you need to go give heartworm prevention every month? Probably not, maybe never. So one of the ways you can figure out if you need to use heartworm prevention on a regular basis, I'll go back to a screen share here, is to go to places like the American Heartworm Society. And they've got this swell map that tells you what the incidence of heartworm disease is. Here's the thing that is really fascinating to me. When I finished veterinary school in 1990, the entire East Coast was this color red, and much of California was. We're actually seeing, they're tracking a decreased incidence of heartworm disease across the country, which is fascinating to me. And so does that mean that there really is less? Does it mean that people just aren't getting their pets tested? Or does it mean that because pets are indoors more, they simply aren't getting exposed? With cats, 15 years ago, I would have told you, yeah, your cat needs to be on heartworm prevention. And I had one of my own cats die of heartworm disease, but it seems to have quit being such a big problem for cats. And so I'm not really sure what the issue is, but this is a great place to start. Check out what the incidence is in your state. It is much less than it used to be. And I think the American Heartworm Society was saying, oh, you have to give it the prevention every 30 days or else they'll develop heartworms because of the resistant strains. And the resistant strains that were found in Atlanta after Katrina seem to have disappeared, and in the Gulf states as well. So that's also interesting to me. Now, what should you use? And to my thinking, I think you should use HeartGuard, not the Plus. So with the fewest numbers of ingredients, and I think at this point, ivermectin and pyrantel, which is a dewormer for intestinal parasites. So HeartGuard or one of its generics, and using those 2 ingredients. It is the least associated with autoimmune disease. There is some concern that it is more associated with seizure disease, but I think that's been batted back and forth. With all of the other preventives, sentinel interceptor, sentinel in particular. I've seen autoimmune disease occur. Revolution, I found it to be not effective. I had one of my dogs actually get infected with heartworms on Revolution. And then the other one is ProHeart 6, which I think is no longer available in tablets and is available solely in injection form. And I have seen that injection kill dogs, as many other veterinarians have. And there was big issues with efficacy. Somehow it got back on the market 10 years after it was pulled, but definitely avoid that one. Now, as far as heartworm goes, that's my recommendation there. And then the other big thing is flea and tick. Your veterinarian tells you need flea and tick prevention. Think it through. Do you live in an area where fleas are a problem year-round? What can you do to help control them in the environment? So fleabusters.com is a great resource for folks that live in areas where fleas are just rampant, and they certainly were in South Carolina. In fact, we had several times where, for instance, Advantage Multi quit working, Frontline quit working. And there's the idea that the fleas become resistant to it. And they are, just laughing at it. The other problem is that you have eaten more Frontline than you have ever put on any of your pets, because it's used in salad bar ingredients to the bugs from getting back into them. So there's a really disgusting tip for you. So as far as fleas go, let me back up one step. As far as ticks go, in the south and southeast, if it's 100 degrees, the ticks can't find you. So once it hits 90 degrees or above, it's not an issue. For the Northeast and many parts of the northern Midwest, ticks are a major problem, and the diseases they carry are a major problem. So the product that seems to have worked most efficiently and effectively with the least amount of impact on the pets is Seresto collars. The other thing that people swear by are shoe tags, which you can get on Amazon. They're supposed to work by disrupting the electromagnetic field around your pet so that it repels the fleas and ticks from getting on them. So Seresto, if you need a topical product, many people are also using things like Wondercide and other essential oil sprays. And I think for many folks, that is perfectly adequate. You do need to retreat on a regular basis. That beats the heck out of another pesticide, which is a hormone mimetic. So I hope that is helpful, but you have to really think about what's the incidence of this bug in my area. In Montana, again, the incidence of fleas is about zip. In fact, for Mona and Pepe, we haven't had to use heartworm or flea controls since we've been traveling. We did go back to South Carolina for 1 month and put their Seresto collars on for that period of time and then split. Other thing that people get really wigged out about is dental care. And there is an organization that's promoted because your vet has said, okay, yeah, we need to clean your dog and cat's teeth. And it's got to be under anesthesia. So let me do a screen share one more time. And so anesthesia is not to be taken lightly, but there are some options. If there is not significant dental disease and you can find one of these folks, there are non-anesthetic teeth cleaning services around. And one of our members had been using it, but her dog hated it so much that the technician finally told her, this is a waste of my time and your money, and you really just need to go ahead and get his teeth cleaned up. So that's a wonderful thing. Of course, if you can do some of this home care by starting to brush your pet's teeth, get them used to you having your fingers in their mouth, that helps tremendously. The other thing you can do is give raw bones or other chews so that they're actually gnawing and chewing the junk off of their teeth. For cats, things like chicken gizzards worked wonders. And those have all been good options. Now you've done all of that or you're getting a late start on it and your pet has really significant dental disease. Anesthesia is worrisome, but if you have a relatively healthy pet and you've done some pre-anesthetic testing as far as making sure kidney and liver function is good, getting some chest x-rays done, and your veterinarian feels comfortable, and really this is the number one thing, then I'm here to tell you, please get their teeth cleaned up. Again, we had to have Mona's teeth cleaned a couple of months ago at 15 and a half. She feels a lot better. When I was negligent, we were bouncing around and not in one place long enough, and she developed quite a bit of tartar on one side of her mouth. She had 2 or 3 of those little premolars that were loose. They came out, all the goo, all the infection, all the inflammation got cleaned up from around her teeth and gums, and she feels a boatload better. So if your veterinarian feels that it is safe and you feel confident in your veterinarian's ability to do the anesthesia correctly, they have a technician there that is monitoring the anesthesia, they're putting in an IV line, things of that nature, then by all means, get their teeth cleaned up. It's going to feel better. If they are so sick that they cannot have anesthesia, there's a couple of other options. One is to pulse antibiotics periodically, meaning take antibiotics for a week, knowing that we're not going to cure it, but we're going to knock the infection back for a little bit. The other is a handheld laser, and this used to work wonderful. There was a lady in my practice that had 2 aged cats, and I think they were like 19 and 20, and they were too frail for anesthesia. So what we'd used to do was take the laser and treat along the gum line, and it would kill the bacteria, it would decrease inflammation. Eventually they ended up dropping a few teeth, which probably needed to come out anyway, but it helped them feel better so that their mouths weren't so sore that they couldn't eat anymore. And that's really what ends up happening with these guys. When you've got 3 teeth that are fixing to fall out, it hurts. So you just don't want to eat because it's just not fun. Now, the other thing your veterinarian may talk with you about is routine lab work. And I really do believe this has value, because if you're seeing small increases in kidney values or liver values, then this is when nutritional intervention works the best. And also, you're going to be able to track things for your pet. If you move and your pet's creatinine has been 1.4 and for 3 years, and you go to a new vet and they're like, oh my God, it's 1.4. You can say it's been 1.4 for 3 years. And the reason I'm using that number is that is the edge of normal. So you can allay that veterinarian's fears and let them know that, no, really, this is okay. We're holding steady here. We eat a higher protein diet. This is reasonable. So I think that has a great deal of value. The other tests that many veterinarians want to do every year are heartworm tests. I think in endemic areas, those are a good idea. Many veterinarians were shocked when they started retesting for heartworms to find that, whoops, this dog was positive. So that's a whole nother bag of wax. So I think that has some value. A fecal test is nearly valueless in my opinion. So the dirty little secret about stool tests is that there was a study that showed for dogs that were known to be infected, and they were known to be infected because this gentleman was studying pets that were euthanized at shelters, unfortunately, and he could see the worms in the GI tract on an autopsy. Only 11% of those pets tested positive on a fecal test. And this is under doing the test that takes longer to do and this sort of stuff that doesn't get done in a conventional practice. So I think unless your pet is having diarrhea, this is almost a valueless test. Now, what about Lyme testing? And I think if you're in an area where Lyme is endemic, yeah, it's a great idea. And also test for anaplasmosis and ehrlichiosis and Rocky Mountain spotted fever, which I guess has been renamed as anaplasmosis. But those things all create a great deal of suffering. They end up creating effects on the other organs as far as kidney disease, heart disease, things of that nature. So I think those are good to know. So what do you do with a positive test? If your pet comes up positive for Lyme, your veterinarian should tell you to do a reflex test to make sure that it really is Lyme and not just I was exposed to Lyme. Does that make sense? I think is what I've got for you today. And